The therapy that I decided to focus on is called natural conversation therapy. It's designed for severely aphasic patients, and I thought it was interesting because it combines the components of two popular approaches for aphasia. One being the impairment based approach, which focuses specifically on linguistic deficits, and the consequences based approach, which focuses on more pragmatic uses of language. So I thought this study was interesting because it combines the two and hypothesizes that with components from each of these approaches applied in a natural setting in a very conversational way, severely aphasic patients will see benefits in their daily lives. So the authors investigate this question by delivering therapy for a period of 9 months to a man they call Mr. I. So Mr. I has had a severe stroke in his left hemisphere, which has left him with motor deficits and also severe global aphasia. So prior to starting the study, Mr. I had little to no interaction with his environment, very little verbalizations, and little to no interactions with his family and his friends. So the therapy starts off by focusing on gaining back some conversational abilities. So the therapy often focused on turn-taking abilities, and just gaining those skills back first. And then it progressed on to focusing on the linguistic deficits that Mr. I was experiencing. So this included gaining back his comprehension skills, using techniques like mimics and repetitions, just to help stimulate Mr. I's production and his comprehension. So after 9 months of this natural conversation therapy, the study concluded that Mr. I experienced very positive outcomes. He improved in all verbal behaviors besides written production. So oral production, repetition, auditory comprehension, reading aloud, and reading comprehension. The strengths of the study include how generalized it is from the beginning. So it's very conversational based, which allows for patients to gain back the skills that will help benefit them in their daily lives. I also think this type of therapy allows for a lot of one-on-one time with clinician and patient, just because the therapy does suggest that therapy is delivered daily for a longer period of time. I think some of the limitations to this study include how little evidence there is to support the effectiveness. The case study allows for us to look at what kind of benefits are seen, but I don't think the therapy will be truly effective until many cultures, ethnicities, and languages are involved in the study. The fact that Mr. I has improved in all aspects of language except for writing, and the fact that he is now able to initiate conversation, he can express his daily wants and needs with his family and friends, I think is the evidence that proves that this treatment is effective, although I would still like to know how effective it would be across a larger group of people.